Hello everyone, good afternoon. Thank you for being with us again. We are now on Doctors Go Live on Columbia Asia Facebook. Thank you again for tuning in. So today we will be addressing the topic of dengue in children because dengue is actually rising in our country right now amidst the COVID-19 pandemic. So it's not something that we have to take lightly. Let's speak to consultant pediatrician of Columbia Asia Hospital, Klang, Dr. Ru Wei. Hello, doctor. How are you today?
Hi, Sakina. Good afternoon, everyone. So I'm Dr. Tan. I'm the pediatrician here in Columbia Asia Klang. So, So today we are talking about dengue fever in children.
Correct. Yes, we are. So let's go to our first question. Why do we still need to address dengue during a time like this? Isn't COVID-19 a more urgent issue?
Yes, COVID-19 is definitely the urgent issue right now, and we have been dealing with COVID-19 a lot. But if we have learned any lesson, in 2009, we had this H1N1 pandemic in Malaysia as well. And during that time, everybody was so excited about the H1N1 that we forgot about dengue. And dengue is something that has been here in Malaysia for almost few decades. And it's not something that will go away. And to put things into perspective, for this year until yesterday, if you go check on our statistics, we have almost 62,000, almost reaching 63,000 cases of dengue in total. 63,000. And out of these 63,000 cases, half of it comes from Selangor. So Selangor is always a very high dengue incidence area. And that's why we need to remember that we have other conditions other than COVID-19 that is causing healthcare problem in our country.
Okay. That's a very scary figure. That's very, very high. And to think that half of it is an area where we all are, basically. Anyway, doctor, talking about dengue among children, would dengue be more of a threat to children than adults, or is it the same?
If by comparison, the good thing, the silver lining of dengue fever is that nowadays it rarely causes death anymore. So of 63,000 cases until the latest statistic that I have is until June, half a year goes by. At that point was about 50,000 cases, about 80 plus death in total. So dengue can cause a huge problem when it comes to healthcare. When we are having dengue, it will be we will be very ill. But the good thing is the silver lining there is that death is rare compared to COVID-19 and a lot of other infectious diseases.
I see. When you say death is rare, does that mean that it is rare now, or it has always been that way, or it has decreased?
It has decreased.
Oh, why? What has brought that about?
Because we became better. Our healthcare has become better, and we learn more. Over the years, we learn a lot of how to treat dengue, and then the treatment has changed. And we now have more technology, more tests that we can do to help us with managing dengue patients. So that has contributed to the drop of the dengue death.
Yeah. Can you give like an example of what are the things that have differed from then and now that has contributed to the decreasing death rate in dengue among children specifically?
Yeah, one of the things is now we can test for dengue earlier. Before this, we usually do dengue, IgM, and IgG to test for the dengue virus. And those tests, you need at least day 5 or day 7 of the illness, and then it will come back as positive. But now with NS1, the result can come back positive as early as day 2 or day 3. So we pick up dengue earlier. And if we pick them up early, then we can start the treatment earlier as well.
Of course.
Start the management.
Okay, that's good to know. What happens when a child gets dengue, ranging from a standard case to the most severe, from what you have seen so far?
So dengue fever in children and in adult is there is more or less the same, but there's a few slight differences there. So number satu ialah the fever will stay. Definitely, if anyone with dengue fever, they will have fever. That's why we call it dengue fever, ada demam.
Yeah.
So once they have fever, in adults, normally they complain of sakit kepala, sakit otot, or sometimes sakit kat belakang mata. Those are the common symptoms. But in children, they more commonly have things like flu, cough, sakit perut, or muntah-muntah, vomiting. So you can see that actually in children, dengue fever is almost like any other kind of a common cold that you can have. It's like flu, fever, cough, runny nose, things like that. That makes it difficult for us to think of dengue, especially in this period of time when COVID-19, their presentation is also fever, cough, flu, runny nose, muntah-muntah, things like that. So sometimes we tend to miss, if we don't have that at the back of our mind that this might be a dengue fever, then we'll miss it. So yeah, that's the challenge with children now.
I see. Okay. But if a child is like really young, and parents of course have to be vigilant and look out for those signs, and they might just mistake that it's just an ordinary flu, for example, and just bring the child down.
That's the challenge there. Sometimes it can be quite common symptoms that we might think that this is not something serious, and then by the time it turns serious, then that's the time that we will have to do a lot more to help control the disease.
Yeah. So would you advise parents from the moment that they notice their children is having runny nose, just rush the child to the hospital right away, or at which point should they worry the child to see an expert?
So basically, if your child has a fever and in recent time you notice that maybe someone in the neighborhood was that you know of had dengue, or you see those KKM people come and spray the mosquito repellent, that means that someone around the neighborhood had dengue. So dengue normally spreads through the mosquito. So if the mosquito were to bite someone with dengue, then that mosquito will be infected, and that mosquito will be able to infect other people. So that will tell you that there is a chance that your child might have dengue if he has fever. Normally, dengue fever, the fever is very high. It will be about 38 to 40 degrees Celsius high. And then it will last at least 2 to 7 days. So if your child has a fever and then it has been ongoing for 3 days and it's not resolving, if you stay in Selangor, everywhere is a dengue-prone area, I would advise that you come to the hospital and get tested for dengue.
Yes. Okay. What about the recovery process? Does a child recover? I'm actually going through my notes, so I'm looking this way. Process. Does a child recover from dengue faster than an adult for whatever reason, physiologically or because it's a younger system? What do you have to say about that?
Well, children tend to turn ill very fast, but they also tend to recover very fast. I'm not sure whether compared to adult they recover faster or not. But basically, for dengue, the recovery phase will probably take about 1 or 2 weeks time. The fever will settle, but after that, you will feel very tired, macam tak bermaya. You will feel like not yourself until about 1 or 2 weeks time. And during that time, make sure that you drink enough water, and then try not to do very strenuous exercises. Low intensity is okay. Jalan-jalan itu okay.
Yeah. But dengue, of course, is not contagious, except for the mosquitoes going around biting people. But does this mean that the child, whenever he or she feels better, that they can already go to school?
Yes, definitely. Well, it depends. If the child really feels very tired, and then we are not concerned about it being spreading through droplets or airborne like in COVID-19. So the main issue is you need to make sure that there's no mosquitoes. Kill off the vectors, and then the disease itself will be controlled.
I see.
I have no issue going to going to school.
To school and all that. Okay, all right. From your personal experience, Dr. Tan, what is the youngest age of a dengue patient that you've seen so far?
Well, if you believe it or not, the youngest I've seen is a baby born with dengue fever. So it's a
Born with
totally
dengue fever.
different. Yes, it's a different kind of dengue. We call it congenital dengue. Uh, when we talk about dengue, what we think of is like the mosquito go around biting the
Correct.
other people and then it spreads. But
Yeah.
in this case, the virus itself is already in the mother's body. And during her pregnancy, she was infected with dengue fever, late pregnancy, and when she was delivering, the
Yeah.
virus went from the mother's blood into the baby's blood. So the baby was born with dengue. But this kind of situation is actually very, very rare. So if you can prevent dengue from happening on a pregnant mother, you would have prevented that.
I
So in
see.
the end,
Right.
actually, dengue is all about prevention.
Yes, of course. Of course. All right. What are the health signs that parents should look out for? I think we've already discussed this lah. You were mentioning just all the symptoms, kan? So, okay, doctor, how can we prevent dengue from endangering our children? Whether it's from a clinical point of view, or any tips that you might have, lah. Maybe you can share that with us.
Talking about the previous question, the health signs that parents should watch out.
Okay,
Other than
correct.
coming back for coming for testing for dengue, if at home you ever notice your child, ask yourself three questions. Number one is whether your child is active or not. If your child is not active, then that is a reason for concern. The second question, in dengue, the most important thing is trying to balance the fluids in the body. Cannot too much, cannot too little. So normally too much is a hospital kind of problem because we give fluids and things like that. But at home, the main problem is too little water. So the second question you ask yourself is whether your child is drinking enough. So
Okay.
if they are not drinking enough, you will see signs like their lips are cracked, dry. Sometimes, if younger children, you might see that their eyes are sunken. In even younger children, you might see that their anterior fontanelle, the kepala atas tu macam terbenam, sunken a bit. So those are signs of dehydration. Then the third question is when our body is really really dry, we will try to conserve water, so they stop passing urine. So the third question you ask yourself is whether your child is passing urine. You check the pampers, it's always been dry for more than 12 hours, or he's not going to the toilet at all. So if you have these three questions, it can tell you how serious the condition is, and you can come early if either one of these three questions is a no.
Okay. Maybe we can repeat those three questions again. So the first one
First one,
is
whether
whether
your
the
child
child
is
is active or
active.
not.
Second
Okay.
one, whether your child is drinking or eating enough. And then
Okay.
the third question is whether your child is going to passing urine.
Okay. Okay. All right. So we hope that all parents out there can make a note of this and ask three questions lah. Yeah.
Yes,
Okay.
correct.
The next one is please share tips on how to keep mosquitoes away. Yeah, we were talking about that as well.
Yes. To be honest, I've tried all sorts of things. Spray, pakai yang plug to the wall punya. But every time I plug, I see mosquito flying past like that. So I think the most effective way I think is to prevent the mosquito from reproducing, from growing more new mosquitoes. So the best way is to clean your house area every week. Make sure you look out for places that can takung air. So the common things is like rubbish. Actually, for dengue virus to lay their egg, all they need is a water as deep as in a bottle cap. Macam tu dah dia boleh membiak dah. So you have to look around your houses, look for places that can takung air, dry those areas. During this rainy season lagi banyak lah. So and then some common things that can takung air that we normally miss is things like bottles, tins, used tires, the plate underneath the pasu, things like that. So every week, move around, exercise a bit, walk around your house, and see whether you have spaces or not. And if you are traveling, after MCO, if you are traveling, close the toilet bowl, close it so that that is one still water that is always there. So close the toilet bowl and make sure if you have any plants in the house, throw away the water.
Okay.
Stop the mosquito from spreading, the dengue will stop spreading.
Okay. All right, doctor. Do you think there will ever be a vaccine for dengue?
Actually, panjang cerita ni. Actually, there is a vaccine for dengue. It's called Dengvaxia. So the problem with Dengvaxia is it was around in the market since 2015. But later on, about 2018 ke 19 macam tu, the company actually came out with a warning that says that people who never had dengue before, if they take this Dengvaxia, then if they kena dengue, it will be very serious type of dengue. The chances of them getting severe dengue is higher. So because of that, at the moment, I think only about 20 countries that approved Dengvaxia to be in their country to be used. If we look at the WHO recommendation, actually, Dengvaxia is recommended for children more than 9 years old, and then comes from a dengue endemic area, which is like Malaysia, and had a documented history of dengue fever before. Those patients, if you know dengue, the first dengue infection rarely is serious. It's the second dengue infection, third dengue infection that becomes really, really bad. So those patients who already had a dengue fever before and then more than 9 years old and has a very high chance of getting dengue again, like in Malaysia, then the vaccine is recommended. But because of the risk of this possible risk of those who are never had dengue before, kena dengue, so I think KKM is still considering whether we should bring it in or not. Hopefully later on with more studies, more improvement in the vaccine, we can use it.
With health science services today, would we be able to know whether a person has had dengue before or not?
We can. If just now we talk about testing dengue IgM and IgG, kan? So IgM is antibody that we release in our body at a very early stage of the infection. IgG is later stage. So in theory, IgG can last for a few months. So if you had dengue before, and then within that few months you do the dengue test, you can probably still pick up the IgG positive. But years later, probably not.
Okay, all right. So I think the most important takeaway that we have for today is actually to be very vigilant. And then ask 3 questions, as you mentioned just now.
Yes. And get rid of the mosquitoes, yes.
Yes, and get rid of the mosquitoes first and foremost. Okay, doctor, we've got a few questions here from viewers. Let's just take a look. Our first question is from Mr. Barjish Paul. Is there any medicine to increase platelet count in case of dengue positive?
No, there's no medicine for dengue per se, and there's no medicine for increasing platelet count. But if you can able to take orally, take some food, take some drinks, then your platelet count will naturally grow eventually.
Okay.
And in a way, So once upon a time, when I was still a young doctor, not that I'm too old now, but at the very beginning of my career, we used to transfuse platelet. Kita ganti balik platelet tu with blood product platelet for those who have really low platelet counts, less than 20, less than 15 macam tu. But nowadays we don't do that anymore. Platelet count is an indicator of the severity of the disease, but if you do not have very severe bleeding, the platelet count itself is not going to cause problem.
I see. Okay, I hope that answered your question, Mr. Barjish Paul. Okay, let's take the next question from Afid 2. Can dengue fever cause fits in children? Yeah, that's a good question.
There are 2 ways dengue fever can cause fits. One is you have dengue fever and at the same time you develop febrile fit. Febrile fit is demam sawan, which is something quite common in children. So normally what happens is when they have fever, they will develop fit. So it's not really like dengue caused the fever, but it's because of then he is having a fever and then he developed the febrile fever. The other way, there might be complications from dengue fever. Sometimes dengue fever can lead to brain infection, encephalitis, and in that situation, yes, there might be the child might be fitting directly because of the dengue fever.
You mean dengue fever is there is a link between dengue fever and encephalitis?
Yes, almost all viruses can cause encephalitis. It's just how common it does that. So dengue not so common, but it's not exactly rare also.
I see. Okay, all right. Let's move on to the next question from Miss Cecilia Chong. Is it possible that a kid to be infected with dengue virus without symptoms?
I think it is possible, but if you are infected with dengue and you have no symptoms, you probably won't come to the hospital. So we wouldn't have known that your child had dengue also.
Yeah.
So I think it's possible, but it's just not enough data to help us with this.
Okay. We've got another question here from Miss Hidayah Sama. Adult patients sometimes used to eat crab soup to heal. Will it be helpful for children also?
For me, if the child is eating, it is helpful. Crab meat, crab soup ke, soup udang ke, soup ayam ke, I don't mind. As long as the child is eating, it's okay. It's helpful.
Okay. Eating, drinking, going to the toilet, passing urine, being active. These are things that should put your worry aside. Okay. Puan Siti Akila Said is asking, is it possible to get dengue twice?
Oh yes, definitely. Well, basically there are four dengue viruses, four serotypes of dengue virus that can cause dengue fever in humans. So in theory, a person once you get dengue virus 1, you are protected from that dengue virus. But there are still 3 more viruses that can still get you. So theoretically, a person in his whole lifetime might have dengue fever up to 4 times, all 4 viruses. Complete satu set, satu collection.
Okay. Here's another one from also Mr. Afid too. Can dengue fever heal without being admitted to the hospital? Maybe under pengawasan parent? I guess this means
fever, there are 2 categories of dengue. One is the classical dengue fever. If you have a dengue fever that is just dengue fever, then it's more or less like a common cold. So the child will be unwell, fever, and things like that for about 2 to 7 days, and then recover by themselves. Under that kind of situation, I don't think you need to be admitted. But at the same time, there's another group of dengue. We call it as a severe dengue. In patients with severe dengue, by the time the fever starts to settle, itu masa yang bermasalah. The blood vessels start to bocor, and all the water that is supposed to be in the blood vessel will leak out into the tissues, and that will cause 2 problem. One, tisu yang sepatutnya tak ada air sekarang banyak air. Then blood vessel yang sepatutnya ada air sekarang tak ada air. That will cause subsequent problem like shock, susah bernafas, air tertakung dalam perut, things like that. So normally we need to admit those who have severe dengue. But the problem is we don't know who will get the classical dengue, who will get the severe dengue. So the safest thing is to close monitoring. If you are very confident your child can still eat, can drink, can pee, can play, and you stay nearby to a healthcare facility, you can get immediate medical attention. I think it is okay for you to want to bring the child back and under pengawasan parent. But if the child has like a very tired, not drinking, not eating, and then not peeing, or you stay very far away, morning husband go to work, no car at home, you want to come to hospital pun tak boleh, then it's better for you to stay in the hospital for close monitoring.
Okay, all right. So hope that answered your question, Mr. Afid. Okay, Doctor, it seems like it's a wrap because we've got no more questions. Is there anything else that you would like to add? Maybe pesanan, some advice for parents out there, apart from the 3 questions?
Now it's musim hujan. Normally, musim hujan is the time where dengue fever incidents spike a lot. So be careful. Mosquitoes, Aedes mosquito normally feed during 1 or 2 hours before sunrise and then 2-3 hours after sundown. So around 6-7 o'clock morning, 6-7 o'clock at night. Those are the times that they are very active. Try to avoid going outdoors during that time. If you're going outdoors, pakai baju lengan panjang, seluar panjang, so to minimize the areas where the mosquito can attack you. And you can apply some insect repellents on the bare skin areas as well. Don't get bitten, get rid of the mosquitoes and you won't get dengue.
Okay. Thank you very, very much, Dr. Tan Ru Wei, for your time. Dr. Tan is the consultant pediatrician from Columbia Asia Hospital, Klang. We have been discussing today about dengue in children, and if you would like to watch, if you have just come in and would like to watch this whole program, you can watch it on our Columbia Asia Facebook page. So thank you for being with us. Thank you, Dr. Tan.
All right. Bye. Thank you. Thanks, everyone. Bye.
Bye.